Action.
Hi, my name's Dr. Stuart Porter, and I lost 10 pounds on the physio teaching plan. I haven't eaten for 3 weeks. Sound check. Sound check. Are we good?
Action.
Action. Cheeky sod. Action.
It's all getting edited out, isn't it?
It's all going to hit the cutting room floor. Okay, so first of all, Ashley, we're doing standing up onto a step, and we're just looking at her left hip for the camera. Okay. So first of all, she is in a neutral position, which is 0. If you got a goniometer, that would read 0. All we're interested in is this hip. Okay. So that is 0 degrees. The first thing that Ashley does is to transfer her weight onto her other leg, which we're not even worried about in the exam. All we're interested in is the left leg. Okay. But actually, what she has to do is rock to the other side to allow the weight to go to that side. Okay. So if you keep that leg on the ground, Ash, and we'll just flex this one instead. So bend your knee up. We're doing it bones first of all, and then muscles. Okay. So she's now starting to flex her hip. That's about 80 degrees. Go a little bit further, Ash. That's 90 degrees. Now you can see she's gone too far. What she now has to do to make sure that her foot hits the step is to actually go back into some extension. That's about 80 degrees, 70 degrees, something like that. Okay. Then, when she rocks forward, she goes into even more flexion. She's now at about 90 degrees. So we're looking at the angle between her lumbar spine and her femur. It's about a right angle, isn't it? Then forward again, Ash. Then she eventually has to propel herself upwards and go back into 0. She ends in the same position that she started in. She's in 0. That's the movements, first of all. Now the muscles, if you go back, Ash, where you started. First of all, while she stood there, that's a co-contraction of everything. So there will be minor changes in her posture. There will be a draft coming through that's tended to push her that way, so she'll have to fight that. There's minor co-contractions of everything, really. Then when she starts to flex, she's going to use her hip flexors. Do that leg, Ash. She's going to use her hip flexors concentrically to do that. She's overshot. She now has to use the same muscles to get longer to hit the plinth. Okay. Now she has to rock forward. This is a bit more tricky. This is probably her other leg that's doing the work. So let's just skip over that conveniently. And then when she stands up, she's now going back into extension, and she's doing that by using her hip extensors concentrically.